My name is Rufus Stacey, and I'm a medical physicist. We take care of overviewing all the quality assurance on our equipment, review plans, oversee dosimetrist work, sign off on all of the plans before they're treated, and then we do the quality assurance of the plan itself. We test out on the machines. Well, the new tru-beam accelerator gives us several major steps forward. Higher precision. We can treat a patient in a faster format, which will allow the patient to be on the table for a shorter period of time, knowing it's very uncomfortable to stay in those fixed positions. This allows us to reduce that stress on the patient, achieve even a better treatment than we were able to achieve in the past, holding higher precision. We also have better imaging, so we're able to utilize that in matching where we want to treat as to what we're actually treating. So we've come some major steps in the last few years with the new equipment. By bringing on the tru-beam linear accelerator, which is a Varian's latest version, it allows us to treat very small fields, to do what we call rapid arc treatments, which does a complete arc in less than 2 minutes treatment time. So the patient is not holding a position for long periods of time in order to achieve giving that dose to the patient. That's really important when you think about patient treatments in the past may have taken 15 or 20 minutes to achieve that same end. That can be done now in 4 minutes or less. With this new machine, we have started our program. We have stereotactic body radiation therapy performed, which helps our patients in this area. They do not have to travel any distance to get that, which is a big help. Number one. Number two, we're able to do that in such a format that these cancers of that type, they're very small, they need the higher dose, and this equipment will allow us to image it, maintain that dose, again, keeping the low dose to the associated tissues around it. So we really have brought that to the center, which previously was not available. In order to make sure that the patient is treated with the dose that is prescribed, there are several things that come into play. On a daily basis, the positioning is very carefully checked using imaging, using alignment lasers each day. I guess the greatest satisfaction is knowing that what we're doing helps people. I think it is a reward in saying that we're going to be able to do the best job we can to treat that patient, because that's why we're here. We're here to treat patients, and we want it done right. And as a physicist, one of my major concerns is we want it right. So we go through a great deal of effort to make sure things are correct. When we calibrate very carefully. We're always focused on that factor. It's got to be right. And we've learned a lot over the years, and we get better and better, and the new equipment helps us even do a better job. So I guess the satisfaction we get is to know that more patients are being treated with better results, better quality of life, and in a number of these cases where the cure rates are improved nicely. So that's really great to see. We have a really great team here at the Cancer Care Center. The team is made up of radiation therapists, it's made up of dosimetrists, physicists, physicians, and we're all focused on the same end, which is a good quality outcome for the patient. It's very fluid. I'd say seamless. I must say I've worked with a number of groups over the years, and this is an excellent group.